collaboration between emergency services has boosted operational capacity and delivered greater efficiencies. Hertfordshire County Council's Fire and Rescue Service is a pioneer of this new approach, training and working alongside ambulance, police, public health and social services, as Nina Warhurst reports.
Mrs Miller?
Yes?
Paul Bromwich, Hertfordshire Fire and Rescue Service.
Oh, morning, Paul. Very nice to meet you. Do come in.
Paul's been with Hertfordshire Fire and Rescue Service for 39 years. But since June, his role's become one you might not expect. On this visit to Frances, he'll do his usual fire safety checks, but will also ask her lifestyle questions to make sure she's eating the right things, is well hydrated, and that there aren't any concerns about her overall health.
I feel much better now that I've seen him and met him, because if I had a problem I could ring him and say, Paul, do you think you could help me sort something out here? Or I've got a problem with this, can you think of something that I could do? Or I've got a friend who's got a problem with something, do you think you could help her?
So you feel safer and happier now he's been round?
Yes, I do, I really do.
The NHS, social services or other partner agencies will refer vulnerable members of the community like Frances. Simple things like making her aware that dehydration can lead to falls help Frances to live independently. But they also relieve pressure on other public services like the NHS and social services. The Safe and Well visits came about by collaborating with public health and social care agencies, enhanced by the fact that Hertfordshire Fire and Rescue Service are part of the County Council.
Jim, from a public health perspective, why does it make sense to work with fire and rescue?
Well, they're a trusted brand. People will open the doors to fire officer when they won't to even a doctor.
Yeah, that makes sense.
They can do a lot of other things as well. They can check your fire alarm and your smoke alarm and your trip hazards, and it's cheaper than sending out a health professional often. So
basically you're improving the lives of the vulnerable while saving money overall.
Absolutely, it's a win-win.
The Safe and Well visits are a brand new innovation, but Hertfordshire Fire and Rescue are constantly looking for ways to improve their more traditional role of responding to emergencies.
In this training exercise, the team's responding to a major road incident. 2 women are trapped in a car. Incident commanders from fire, police and ambulance services come together to formulate a joint plan.
Right, OK, what we've got is a situation you can see in front of you.
It's part of the Joint Emergency Services Interoperability Programme, or JESSOP. The programme was created after the 7/7 bombings revealed that sometimes services weren't even literally speaking with the same language. It's allowed the emergency services to work more effectively by creating a unified way of working.
So we've seen you chatting with Jim and John. How much of a difference does it make to your role having that support from the other incident commanders?
It makes a massive difference. We can all work together as a team and we can use each other's resources effectively so that everything's done as quickly and as efficiently as possible.
Do you think it could go some way towards saving lives?
Absolutely, yeah. The quicker that we can get in, the quicker that we can get a big picture as to what's going on, the more chance we have of saving lives.
For the Chief Fire Officer, who also oversees community protection, he's confident the JESSOP programme will help save lives and is delighted at the way it's been embraced in Hertfordshire. He's also proud of the way Hertfordshire firefighters are going out to the community to support vulnerable residents.
So how do you feel when you think about your team and the Safe and Well visits that they do?
Well, I'm really proud of the firefighters and the other staff in Hertfordshire Fire and Rescue Service and the wider directorate. Now, we really work hard to go into people's homes and make them safe, keep them safe from all sorts of things, whether it's fire safety, whether it's isolation, whether it's nutrition, whether it's scams. I think we're one of the best services in the country for doing that, and I'm really proud of the way they go and serve the community.
Back at Frances's house, Paul's decided she needs a handrail fitting. Not exactly what you'd expect from a firefighter, but all part of collaborative working and keeping the community safe, well and independent.
Oh yes, that's a lot better. Thank you very much.